everybody. My name is Claire Feldman. I'm the Director of Wellness here at Petaluma Health Center.
My name is Dr. Fasih Hameed. I am the Medical Director of Wellness and Integrative Medicine at Petaluma Health.
We're going to go ahead and start off today by sharing with you a little overview of our health center. We are a federally qualified health center that serves southern Sonoma County. We have 7 health centers, sites serving over 35,000 patients within our region in the Bay Area. We have 2 main health centers, one in Petaluma and one north of Petaluma in Rohnert Park, which is south of Santa Rosa. And we have 3 school-based health centers, 2 at large high schools in the area and another at Santa Rosa Junior College at the Petaluma campus. Our 6th health center site is at the Mary Isaac Center, which serves our transient and homeless populations in the area. And our 7th site is a pop-up vision center inside of Walmart.
And our community is a very diverse community here in Sonoma County. In our individual population, we have, across all sites, about 22% of our patients are uninsured. About 50% there are monolingual Spanish-speaking. 31% of our patients are children and young adults. And then you can see that we have a large percentage of adults, age 18 to 64, and a smaller percentage of older individuals. In 2012, we surveyed our health center population and found that about 1/3 of our families with school-aged children reported some degree of food insecurity. That is in contrast to about 15% nationally at the time when we did that survey. And at the same time, and this is to highlight the sort of paradox of food insecurity, which is that food insecurity does not usually lead to, in most cases in the United States, it does not lead as much to underweight, but usually to an elevation in BMI in these children. And so at the same time that we have 1/3 of our families with school-age children having food insecurity, about greater than 50% of our pediatric population has a BMI of greater than 85%. And that goes along with that paradox of food insecure, but at the same time getting higher calorie, lower nutrient quality foods, which lead to an elevation of BMI and obesity and all the complications that ensue. So it isn't just a matter of getting more food to our patients and to our populations, our community, but about getting access to healthier foods. And so when we started to look at this problem and develop our programs, we really leaned on the community resources that already existed. So we've been developing partnerships with several community organizations for years now, and we'll highlight 2 of those at the end, but I will mention that this is an overview of the programs we currently have. So a community garden, a demonstration kitchen, a pop-up farmers market, a grocery raffle, and some strategic partnerships, which we'll talk about at the end. I just want to mention this. The community garden was done with the help of Petaluma Bounty, but also the City of Petaluma and numerous other community organizations that helped us to take a 5,000 square foot green belt and mulch it and turn it into a beautiful, thriving garden that is capable of growing a lot of food and which does grow a lot of food for our patients and community. It's a beautiful thing. We look at it also as a totem that not only will it grow food, but it shows that we understand that healthy food and that health begins with some basic lifestyle factors, and food is a major part of that. And so first thing you see when you pull in a parking lot is this garden, and I think that that's a good symbol of what's going to happen inside the walls of the health center as well. The demonstration kitchen is something that we needed to build in the second phase. As we built this building, we designed the kitchen into it, but didn't have funding to complete it. And so we actually had to do separate fundraising to get the funds to build out the kitchen. The way it's used is cooking demonstrations in shared medical visits, but also open, free cooking demonstrations every other month for the entire community. And those are run by our nutritionists, and they highlight healthier options and healthy options of eating, and they are becoming quite popular, actually. And I will talk about the pharmacy in the next slide. It's an evolution with our relationship with Petaluma Bounty Farms, and I'll let Claire talk about the grocery raffle and take it.
Great, thank you so much. So the grocery raffle is a program that we offer that is really unique to our health center, where patients that pay in full, that pay their bill or their co-insurance or any part of their cost sharing in full at the time of visit, they are eligible to enter into a raffle, and every month a raffle winner is drawn, and the recipient will receive $500 gift certificate to Safeway. So through this grocery raffle, traditionally the winner, in order to receive the gift certificate to the grocery store, also will engage with our nutritionist and have at least 2 visits with the nutritionist to learn more about how to use that food for healthy cooking and really be more specific to their needs and their family's needs in being able to use those groceries in a way that supports their health. And then in addition, we really wanted to talk today and highlight our strategic partnerships. So we as a health center value many different methods and strategies to enhance health through food consumption and healthy food consumption. We had long-standing relationships with both the Redwood Empire Food Bank and Petaluma Bounty Farm. So the Redwood Empire Food Bank serves Sonoma County as a whole. So even though our health center serves southern Sonoma County, the food bank is a very large organization and does a tremendous amount of work in our county, in Santa Rosa and in northern Sonoma County as well. We have become a food drop-off site for both our Petaluma and Verona Park Health Centers. So we have volunteers that pack food into these large grocery bags, and they distribute to the community. Not only our patients, but anyone within the community can come once a week to each one of our health centers and pick up food from the food bank. The food really includes what's available. Every week is a little bit different, but there's vegetables, fruits, lots of times there's some sort of carb that is packaged. We have been as specific as we can about keeping the sugar content low and really doing our best to ensure that the contents of the foods are meeting the needs of our patients in terms of keeping their health in mind.
Yeah, that's one of the most beautiful parts of the relationship with Redwood Empire Food Bank that I've been impressed with is that they did seek our input, and our last nutritionist and myself went through the list of foods and sort of, these are good foods, these are not good foods, these are good foods, these are not good foods, and so it really, when you look at what people are coming out of there, it's not what you would normally think of, coming out of a pantry with canned goods and a lot of dry packaged goods. As Claire mentioned, there is some of that, but the bulk of it is these like beautiful bags of fresh produce, and I think it's just so wonderful that people have access to that. Sometimes whole crates of broccoli will show up, and it's just a beautiful thing. So we're very happy with that relationship.
Yep, and many times the leftover food is then available for our staff as well. We see our staff taking home those fruits and veggies to their families. We also, just last year, have become a member with the food bank in a different way, where we are able to go to their main hub located in Santa Rosa, and our staff picks up non-perishable foods for students to distribute in our school-based health centers. It's been a real hook for students to be able to come into the health center to learn more about the services we offer, but also to just come in and get a snack anytime that's needed. And we, definitely have seen an increase in engagement with the students within our health centers, but also serving a need because many of our students don't bring a lunch or they don't have the means to eat lunch or eat a snack during the school day.
So Petaluma Bounty is a local farm and nonprofit whose mission is really to redistribute and to distribute healthy, organic, locally grown, seasonal produce to people that would otherwise not be able to afford it or do not have access to that. And they do it through several programs. They have a 2-acre plus farm. They have a gleaning program where they sort of redistribute leftover food from farmers markets into food pantries as well. And we've had a long relationship with them, almost 10 years. It's been a very long relationship. And it's evolved beautifully over time. Initially, they were bringing us through a grant. We were able to purchase essentially CSA boxes for families that were enrolled in our pediatric wellness and obesity program. And families would get a box of fresh produce weekly, and we would use the fresh produce to guide some cooking demonstrations. And that program, after funding evolved into a more, what we think, sustainable opportunity, which was that we have now this seasonal farmers market inside of Petaluma Health Center. And the beauty of it is that because of that off-of farmers market, Petaluma Bounty obtained the appropriate hardware to be able to use CalFresh, essentially the EBT, local EBT, or what would be called like the food stamps, to allow patients essentially and staff to use CalFresh to purchase this produce which you would normally only be able to buy with at the farmer's market. So they bring this beautiful produce into the front of the health center, and you can use EBT, and that is coupled with a sliding scale. So if you are affluent, you would pay more, and if you are less affluent, then you can pay to the lowest sliding scale, plus using your CalFresh. So it becomes a lot more of a reasonable option for obtaining low-cost, very healthy, very wonderfully fresh produce. So we really love it, and we're happy to see that that's in the whenever it's happening in the season. It's a beautiful thing to see it in the front of the health center. Right when you walk in, you're just confronted by a mountain of seasonal produce.
Absolutely, and I think another really important part of our pharmacy is that we're able to bring a farmer's market to a population that may not normally seek it out on their own, and I think that that's one of the lovely things about our health center is that we really work to bring resources to our patients instead of having our patients seek out resources. That being said, last year we received a grant from the City of Rohnert Park in partnership with Petaluma Bounty for $5,000, and so with the $5,000, Petaluma Bounty worked with the coalition of local farmers markets in Santa Rosa, Rohnert Park, Petaluma, and we were able to create free vouchers that we distributed to our patients in our Rohnert Park Health Center that they could bring to any farmers market location in Sonoma County to redeem for produce. So each patient was offered a packet of $5 vouchers that totaled $20 to bring to the farmers market that they could use to buy produce only. So they weren't able to buy eggs or meat or any other products from the farmers market, just produce for these particular voucher programs. And what we found is that there was a 60% redemption rate over the course of 2 months when we were offering these vouchers. So we're really highly impressed with our patients' initiatives to use these vouchers and actually go to the farmers market and engage in the farmers market in that way. So really being able to have the pharmacy where we're bringing the farmers market to our patients, and then also have this new voucher program where we had seen an uptake in the patients engaging with the local community and engaging in their local farmers market as a way to obtain healthy food for their families has been very successful. Great, so those are the programs that we wanted to highlight today. We encourage you to reach out to either of us or both of us with any questions about the programs that we currently offer to our patients or any that we have conducted in the past. We're always interested in partnering with other organizations and sharing best practices and learning from other health centers to best support our patient population and those in California and beyond.
And I think that it might seem like, well, we were doing a lot, but we started really with very small projects, and they've sort of grown, and they take on a life of their own, and they evolve, and they become self-sustaining when they go on and are functional when you reach out to the community and lean on the existing programs and you try to do everything yourself, then it's hard to keep those things going. So we really encourage you to evaluate what's already there and then to find the strengths of the community and build on those partnerships. So thank you so much for listening, and take care.
Thank you. Bye-bye.